Well, we were pretty shocked to hear this statistic from the Pain Foundation. Nearly 1 in 3 U.S. adults needed financial help in the past year to cover out-of-pocket medical expenses. Just imagine that. We want to give you more info about how the Pain Foundation helps people get the care they need. Here's my interview with CEO Kevin Hagan.
Kevin, good morning to you. I want you to share more about the PAN Foundation and how it helps people access that health care that they need.
Well, thanks for having me today, Claudia. It's nice to be with you. Uh, for those who may be unfamiliar with the PAN Foundation, we are a national patient assistance foundation. And basically, PAN Foundation really works to ensure that everyone can access the treatments that they need and never have to choose between their health care and their financial well-being. And our programs actually span a variety of channels, including direct financial assistance, but also advocacy around access and affordability, as well as patient and provider education. You know, we've been around for 20 years, and in that 20 years, we have been honored to serve 1.3 million Americans and have provided over $4.5 billion in financial assistance to them through about 80 disease fund areas that we operate. And those 80 diseases include things like types of cancer, chronic conditions, and even some rare diseases. So there are people in your audience today that may actually be eligible for financial assistance from PAN, and we wanted to really make sure that they're aware of this resource.
Wow, you guys really do great work. Now, you've got some research that you could share with us this morning regarding financial assistance and the impact it really has on people's lives.
That's true. So the PAN Foundation runs a Center for Patient Research, and in one of our recent polls, we found that 1 in 3 U.S. adults needed financial assistance to afford their healthcare expenses last year. But what was interesting to us is only 20% actually reported being familiar with financial assistance programs like the ones that we have here at the PAN Foundation. And many people said that their mental health were suffering due to the challenges that they had affording their health care. What was also interesting to us on the PAN side is that we do our own research around our patients that we serve. And 90% of our patients who receive financial assistance said that it had a positive impact, not only on their health outcomes, but their overall quality of life and their overall outlook on life. So that's when it became really clear to us that we needed to get out and do more communications, letting people know that these important programs are available for them.
Yeah, that's definitely important. There could be so many people out there who could really benefit from this. Kevin, what kind of immediate assistance is available through the PAN Foundation? How does somebody access that?
Well, as I mentioned, we cover about 80 different disease areas right now. And currently, we have funding open in 30 of those disease areas. So funds will open and close from time to time based on funding available. And we have 30 disease areas that are open. So for example, if you know someone living with a blood cancer right now, whether that be chronic lymphocytic leukemia or Waldenstrom, they could be eligible for up to $4,000 in financial assistance from PAN. And those disease funds are first come, first serve. They're very easy to apply for. And we would encourage everybody to sort of reach out and check to see if they are eligible for assistance.
Okay, on that note, how can somebody apply and what's the first step?
So the first step is determining your eligibility. And we do actually have all of our eligibility requirements listed on our website at panfoundation.org/assistance. But generally, they're very similar. And you need to be diagnosed with the disease that you're seeking assistance for. You need to be in active treatment for that disease. And we do have income levels because we want to service the patients who most need it. But those are generally around 500% of the federal poverty level, which of course no one knows what that means. So let me give you an example. For a family of 2 in the US, that would be if you make less than $105,000 a year. So you may think you don't qualify when you actually do. So we would really encourage people to check that eligibility. And it is provided on a first come, first serve basis. So if we have a fund open and you meet the eligibility requirements, you will be given the grant.
Okay, panfoundation.org. Kevin, thank you so much for such valuable info this morning.
Oh, thank you for having me. It's great being with you this morning.
And the PAN Foundation is there to help with financial assistance for medical care. If you want more info and to see if you qualify for assistance, go to panfoundation.org/assistance.